Hey guys, Dr. Horst here. I just wanted to talk to you guys a little bit about breathing. I'm sure a lot of you noticed that I posted a video of me getting a balloon shoved in my nose over the weekend. Pretty crazy, pretty intense. Well, I had a lot of people that sent me messages and patients asking me, why did you do that? Why would you ever think to do that? Well, it all comes back to breathing. What a lot of people don't realize is that when we breathe, our skull actually moves, specifically a bone called your sphenoid and your occiput. And when we breathe, they actually expand and contract. And what can happen sometimes is if those bones are essentially locked up, then we're not going to be able to breathe correctly. And what this will do is this will affect our sinuses, snoring, yeah, really bad snoring, difficulty breathing like I had, and also a variety of other things. But and TMJ is also a big issue that I see a lot. And by making it so that way the cranial and the facial bones actually move correctly, you're going to be able to breathe better. And I got to tell you guys, I don't usually make videos like this, but after having this done, I've slept better and breathed better than I ever have my whole life. About 10 years ago, I had a pretty bad concussion. It took me about 8 months to recover from. Essentially, I hit my face on the water going about 35 miles an hour and knocked me out cold. And it took me a long time to recover from. What I didn't realize at the time is that I actually shifted my cranial bones a little bit in this way. And so whenever I'm doing CrossFit, I would always find myself in the corner after I'm done working out, hacking up my lungs. And why was this? Well, I thought it was just my lungs. Well, now that I find out, it was actually because I wasn't breathing effectively and efficiently while I was working out. And I got to tell you, seriously, this is pretty insane. The results that I personally saw, and it's really great. It's really great to actually feel like when I breathe that it's there. A lot of people were really concerned about how intense it looked. Yeah, you know what, it can be a little intense. What we're actually doing is we're inserting a balloon into your nose, but more importantly, into your face. And there's 3 different openings actually that we're going into what's called your nasopharynx. And the whole goal is actually to blow up this balloon. And what this does is actually increases the mobility within those bones that I was talking about. And we blow it up enough until it gets to the back of your throat, and then we immediately release. And what this does is this causes more pressure than you've ever experienced in your life, and you hear very loud crunches at times, and it's a little uncomfortable. But the issue is it doesn't hurt. What it is it's not familiar. And in my videos, I certainly didn't look like I was very comfortable. But let me tell you, it's absolutely worth it. If any of you have ever personally seen me as a patient and have had your IT band worked on, or your tibialis posterior, or you name it, ART doesn't always feel the greatest, but it's familiar. This is not familiar, and it's something that I could go on and on about. And if you guys want to know more info, shoot me a message. We are running a special. Again, I don't generally ever try to do this at all, but I just really want people to know that if you or you know someone that is having TMJ issues, chronic headaches, sinus pressure, clogged ears, and even some cases some vision disturbances, it responds favorably from craniofacial release, which is what this is all about. So shoot me a message, give us a call, 951-693-2208, and I really look forward to getting you guys feeling well, breathing well, and sleeping better. Thanks.